Good morning all. Today's topic is sulfonamide, quadrimoxazole and quinolones. Now, first is the sulfonamides. Sulfonamides were the first antimicrobial agents uh, effective against pyogenic bacterial infections. Sulfonamide, uh, chrysodontines, and was one of the days includes by the dogmas to the treat experimental staphylococcal infection in mice and found in it is to be highly effective. Subsequently, an infant was cured of the staphylococcal septicemia by protozoals. It becomes clear the brontocells was broken down in the body to release sulfonamide, which was the active antibacterial agent. A large number of the sulfonamides were produced and used intensively in the subsequent years, but because of a rapid emergencies of the bacterial resistance and the availability of the many safer and more effective antibacterials. Here the sulfonamides chemistry. All sulfonamides may be considered to be the derivatives of the sulfonamides. Sulfonamides that are the still of a clinical interest. Short acting 4 to 8 hours sulfonamide is intermediate acting 8 to 12 hours and sulfamethoxazole. Then long acting 7 days sulfadoxine and sulfamethoxazole and special purpose sulfonamide sulfacetamide sodium and methadone silver sulfonamides and antibacterial spectrum. Sulfonamides are the primarily bacteriostatic against many gram-positive and gram-negative bacteria. Higher bacterial concentration may be attained in urine. Many staphylopyogens, Haemophilus influenza H, decrease Callimametobacterium, granulomatous, and Vibrio cholera. Only a few cephalosporins, gonococcal, meningococcal, pneumococcal, and Escherichia coli and Shigella response, but majority are resistant and anaerobic bacteria are not susceptible. Calamains, tropoma, lymphadenoma, and venerum. Mechanism of action. Many bacterial synthesize their own folic acid and which P-amino benzoic acid is constituted and it's to form the medium woods and fields. Purpose the hypothesis that sulfonamides being structural analogous of PABA inhibit bacterial fetal synthesis. FA is not formed and the number of the essential microbial reactions. Here the human cells also required FA, but the utilized performed FA supplied in the diet and unaffected by the sulfonamides evidence in the flavor of this mechanism of action. BABA is a small agonist the antibacterial actions of the sulfonamides. Only those microbes which synthesize their own FA and cannot take it from the medium to the susceptible. Now, resistance to the sulfonamides. Most bacteria are capable of the developing resistance to sulfonamides. Prominent among these are gonococcal, pneumococcal, staphylococcus, and meningococci, E. coli, Shigella, and some streptopyogenes and streptoviridans and anaerobes. The resistance mutants either produce increased amounts of PABA or their photosynthesis enzyme has the affinity for sulfonamides or adopt an alternative pathway in photal metabolism. Resistance developed in vivo is quite persistent. Sensitivity patterns have changed the developing on the extent of use. When an organism is resistant to one sulfonamide, it is resistant to them all. No process resistance between sulfonamides and the other AMS has been noted. Development of resistance has marked limited. Now, pharmacokinetics. Sulfonamides are rapidly and nearly completed observable from the GIT extent of the plasma protein binding differs concentration 10 to 90% among different membranes. The sulfonogens, it is a prototype of the general purpose of sulfonamides rapidly absorbed. Sulfamethogens, it is slower oral absorption and urinary excretion resulting in the intermediate duration of the action. And sulfadoxins, sulfomethogens, they are the ultra long acting compounds, actions lasting more than 1 week because of higher plasma protein binding and slow renal excretion. Sulfatamides, sodium, it is a highly soluble compound yielding natural solution which is only medially irritation to the eye in the concentration up to the 30%. The mephenide, it is not typically sulfonamide because CH2 bleaching separates the benzene ring and the amino group. It is used only topically inhibits a variety of gram-positive and gram-negative bacteria. The silver sulfonamides used typically 1% cream. It is active against a large number of the bacteria and the fungi, and even these resistance to the sulfonamides. Now, sulfasalazine used in the ulcerative colitis and rheumatoid arthritis. Now, its adverse effect: nausea, vomiting, epigastric pain. Crystallureum is used related but adequate now hypersensitivity reactions occurs in the 2 to 5% patients. These are mostly in the form of the rashes, urticaria, and drug fever. Hepatitis unrelated to dose and occurs in the 0.1% patients. Topical use of the sulfonamides is usually allowed because of risk, and hemolytic can occur in the G6PD. And interactions, sulfonamides inhibits the metabolism of the phenytoin and the tolburamide and the warfarin. They displace methotoxins from the binding sites of decrease the renal excretion. Toxicity can occur. Uses: synthesis of sulfonamides alone combined with the trimethopans in the rate now through they can be employed for the placebo combined with the trimethoprim, and sulfamethoxazine is used for the many bacterial infections, P0 vacci, and necrodicosis. Ocular sulfonamides, sodium, is a cheap alternative in the trachoma and influence conjunctivitis and through the additional sensation. Now, the second drug is cotrimoxazole. The fixed dose combination of the trimethoprim and the sulfonylurea is called cotrimoxazole. Trimethoprim and is a diaminopyrimidines related to the anti-malarial drug and permethrin, which selectively inhibits bacterial dihydrocotyl reduce. Here the figure of the sequential block is the bacterial fetal metabolism (PABA) and para-metabolic for DHFA, diaphoric acid, and DHFA tetrahydrofolic acid. Now here the active against bacterial DHFS, then against the mammalian enzyme. Thus, human fetal metabolism is not infiltrate of the antibacterial concentrations of the trimethoprim. Individually, both the sulfonamides and the trimethoprim is bacteriostatic, but the combination becomes seedal against organism. The sulfamethoxazole was selected for the combining with the trimethoprim because both have nearly the same times t-half 10 hours, and optimum synergy is cases of the most organism is inhibitions at a concentration ratio of the sulfatoxazoles. Now, spectrum of the actions, antibacterial spectra of the trimethoprim and the sulfonamides overlaps considerably. Additional organism covers and the combinations. Resistance. Bacteria are capable of the acquiring resistance to the trimethoprims mostly through plasmid mediated acquisition of the DHAs. Here the adverse effect. All adverse effects seen with the sulfonamides can be produced by the cotrimoxazole. Nausea, vomiting, stomatitis, headache, and the rashes are the usually manifested. And here the portal deficiency is infrequent, occurs only in the patients with the marginal fetal level. Blood decreases occurs rarely. Cotrimoxazole should not be given during pregnancy. Trimethoprim begins and the anti-fetal. This is the theoretical tetragonic risk. The patients with renal disease may develop uremia and higher conditions of the fever, rashes, and bone marrow hypoplasia has been reported. The early are also at the greater risk of the bone marrow toxicity from cotrimoxazole, and diuretics given with the cotrimoxazole have produced a higher incidence of the thrombocytopenia. Now, there is its uses through the cotrimoxazole is still used. It's the prophylactics is the treatment of the systemic infection. Here the urinary tract infection, most acute uncomplicated infections, respiratory tract infection, both upper and lower respiratory tract infection, bacterial diarrhea, and dysentery. Cotrimoxazole may be used for the severe intensive infections of the E. coli. Pneumococcistic pneumonia causes severe pneumonia in the neurogenic and the AIDS patients. and the concrete cotrimoxazole BD for the 14 days is to the third choice of the donor. Typhoid intensive cotrimoxazole was is the